Welcome back to another 5 Questions With, and we are back with 5 Questions with a Doc. I'm here today at Adena Regional Medical Center with Dr. Atiq Rehman. He's a cardiologist here. He's actually one of the new cardiologists here. Dr. Rehman, thanks for being with us today.
I appreciate it. Thank you very much. Thanks for inviting me.
Sure. So can you give us a general overview of some of the services that are available through Adena to address coronary artery disease and how some of those technological advances like robotics are contributing to that care?
Yeah, so Adena, I think we need to consider it as a regional center. And we are here offering everything which is available out there in any other big center as well. Actually, we are offering things which are not available even in Columbus. So as you mentioned about robotic surgery, so coronary artery bypass grafting traditionally was done through what we call a breast splitting incision, and you know, it looks very gruesome as well, and it is actually probably, but it's still being done. However, what we do is in a certain select patients, we do with small keyhole incisions and use robotic assistance with that, and the outcomes are fantastic, and that's not even offered in Columbus. So I think Adena is moving ahead as a regional center, but also as a tertiary care center as well.
Yeah. And as you mentioned, a lot of people have this sort of gruesome image of open heart or heart valve procedures. So how does what you do with that different from that image of what people actually see?
Right. So if you were to look at heart disease as 2 main areas, one is when you have coronary artery disease, when blockage of the arteries happen, or they could be valvular heart problems. Those are 2 main areas. In the valvular heart problems, again, you could do a regular standard open chest procedure, or again, what we do here is a small keyhole incision with like 3-finger breadths or 4-centimeter incisions, and patients are actually going home in 3 days, 4 days. When we just mentioned about the robotic bypass surgery, some patients are going home with overnight stay as well. So I think it's a dramatic change. In addition to the surgical options for valve surgery, we can do what we call non-invasive and transcatheter procedures. So there's something in acronym known as TAVR, T-A-V as Victor, R, Roger, TAVR, and that's transcatheter aortic valve replacement. And that's, again, we brought this new to this area. We've been doing this for the past 1 year. And in addition to that, upcoming things, which I would say MitraClip, which is another transcatheter procedure for mitral valve. We're going to start doing that in a few months as well. So I think Adena is going way faster than what we would expect as well. And it's certainly a regional center covering all the surrounding counties and many things which are not even offered in Columbus.
I would imagine that the less invasive the procedure, the better it is for the patient in recovery. Yeah. Can you talk a little bit about the benefits for those? You already mentioned the shorter stay in the hospital. What are some of the other benefits for the patient?
Yes. I think one is pain, it's less pain, blood loss is less, of course hospital stay is less, and once you get out of the hospital, many people are in the workforce. They cannot take downtime, you know, so the quicker you can go back to your work environment, the better it is for you. And with all these techniques, you can be back at work within a week to 2 weeks time. Traditionally, it's like 8 weeks downtime. So I think it's a dramatic difference. Plus, in addition to the recovery time and everything, the rate of infection is way lower as well. So I think that's a big difference.
Obviously, having to undergo a heart procedure is often the result of issues that build up over time. So what can someone do in terms of preventative care and self-care to hopefully avoid having to come here and even go through those procedures in the first place?
So I think that's a very important thing because medicine is going towards preventive care anyway. And in cardiovascular, that's the largest, if I may use the term, killer in the world. So we have to be working on that. So on a personal level, it's lifestyle modifications, which includes diet modification, which would mean low carb, low fat diet. You need to do regular exercise. You need to stop smoking if you're a smoker. If you have to drink just modestly, or maybe once a wine or something, you know, once in a while, but not excessive drinking. And besides that, you need to have regular doctor visits, because many people, it's difficult to stop smoking, it's difficult to keep your cholesterol and lipids in control, and that's why drugs will come in or medicines will come in and doctors can help you with that. And once you've done that, I think you've done your part. The rest is up to your genes, I would say, you know. So.
And some genetics obviously are more impactful for people than others, right?
Exactly. And to that point, I mean, some people, cholesterol is not coming down because they're genetically prone to that. So that's where your cardiologist, your primary care could help you.
So finally, I want to talk a little bit about the future of cardiovascular care here at Adena. What do you see as the future of it here, and how will that benefit more patients down the road?
So I personally was brought in to modify and improve the cardiac surgical part and the structural heart part. And that's not me only. There's a whole team. There are 9 cardiologists who are fantastic. Some of them are my partners in structural heart programs. We have 2 fantastic vascular surgeons. That's the current state of affairs. The future state, we are going to continue growing and serving all the surrounding counties. And our goal is to make a heart center here, which will be a unique thing for this area. And again, to be able to serve this particular community and surrounding areas with all what is possible in cardiovascular care. And that's our goal.
Yeah, we'll be sending a lot of people 2-3 hours away, keeping them right here where they can recover around their family.
Yeah, I think I would say even today, 95% of patients we can keep. Less than, for example, someone needs a transplant or something that we're not offering, but everything else we can take care of them here.
Well, Dr. Rehman, thank you very much for your time today. And thanks again to Adena Health System for allowing us to come out for 5 questions this week. And we'll see you soon with another 5 questions with.